Hello, I'm Marcy Forta, and I'm so excited to be here with you this evening and have this opportunity to speak with you about body image, eating disorders, and how we can help our daughters. I work in eating disorder awareness, education, and prevention. And I am the founder and director of OTSME, which is a nonprofit organization which was created to support the mental health of from adolescent girls via what we call the My Best Self Project curriculum. It works to increase their self-compassion, body acceptance, and reduce the focus on outward appearance, among other topics that we cover. And part of what we do are these parent workshops, as well as ones for teachers. The overall goal is to use Torah and Hashkafa, along with empirically proven methods, to help our daughters develop a healthier body image and head off eating disorders. I used to run a women and girls clothing store here in Michigan, where I'm from, and it really affected me watching young girls struggling in their changing bodies as they become young girls to young women, and then young women struggling when they became young mothers, and even mothers as they got older. Everyone really struggled with their body, and it affected me profoundly, particularly because it was something that I related to intimately as someone who grappled with my own eating disorder as a teen. And while, thank God, Baruch Hashem, I was able to recover from it, not everyone is as fortunate, and we really need to find better ways to head off these devastating illnesses. So let's get started. We have a few things to cover this evening, but when we're finished, I'm going to make time for any questions and answers, and some of you have already submitted those, so we will go right into that when the presentation is finished. So I like to start with some statistics so we know exactly how significant the problem is that we're dealing with. Research shows that around 50% of 13-year-old American girls report being unhappy with their body. And this number actually grows to almost 80% by the time the girls reach 17. And for women over 21, estimates are well over 80%. The numbers also show that 81% of 10-year-olds are afraid of being fat. 80% of 13-year-old girls have attempted to lose weight, and 50% of girls between the ages of 11 and 13 actually see themselves as overweight. There are also numbers that show between 35 and 57% of adolescent girls engage in some form of either crash dieting, fasting, self-induced vomiting, using diet pills, or excessive exercise of some kind. Believe it or not, 35% of 5-year-olds are already restraining their food intake in order to lose weight. I have a friend who told me a story about her granddaughter who she was over, and she was giving her a bath. She's 5 years old, and she was in the bathtub. And she comes from a family with no secular media whatsoever in their home. And this 5-year-old looked at her grandmother and said, "Bubby, look at me. I'm so beautiful because I'm skinny." And she asked me, how is it that possible that this 5-year-old is already saying that if she doesn't have any secular media and she's not seeing those messages from outside? So we're getting these messages even within our own community. And 42% of first to third grade girls want to be thinner. I have a colleague who used to be a teacher, and now she works in eating disorder prevention as well, who had a class of first graders, and she was noticing that they were throwing out their lunches every day. And she asked them, what's going on? Why are you throwing out their lunches? And the girls said, we want to be thin. So we're throwing away our lunches because we all want to be skinny together. So they basically made a pact to throw out their lunches in first grade. The sad reality is there have been huge increases between 40 and 50% in eating disorder incidents reported since COVID. And this is all over the world. This isn't just here, but really all types of health professionals, medical health professionals, mental health professionals are really sounding the alarm that the growth rate of them are higher than they have ever seen. And so even though we're really technically no longer in a pandemic, the mental health implications have created some very difficult and uncertain situations, especially for adolescents and teens. And there just have been alarming numbers of growing numbers of inpatient hospitalizations, outpatients, referrals, even emergency admissions since the onset of COVID in 2020. The numbers show that between 9 and 12%, that is 29.8 million Americans or 70 million people worldwide, will be diagnosed with an eating disorder during their lifetime. And this is only diagnosed disorder. So it doesn't really refer to how many people are struggling with food and eating in general. 95% of those who have eating disorders are actually between the ages of 12 and 25. And in the last decade alone, the number of preteens being treated for anorexia has doubled. Eating disorders actually have the second highest mortality rate among mental illnesses in adolescents, and it's second only to drug overdoses. although some studies are actually showing that they're more neck and neck as far as the incidence of them, but it is the second leading cause of mental health disability for adolescent girls and young women. One death every 52 minutes, that's 10,200 deaths each year, can be attributed directly to an eating disorder. It could be from suicide, but there are also many health complications from eating disorders. And sadly, about 26% of people with eating disorders attempt suicide, meaning they are 11 times more likely than the general population to do so. Females are twice as likely to develop an eating disorder over males, although the number of boys or males with eating disorders is growing. And unfortunately, yes, there are 5-year-olds that have been diagnosed with an eating disorder and are in inpatient facilities with that kind of a diagnosis, and women as old as 80 years old. So I think what this demonstrates to us is just how deep-seated some of our body image and appearance ideal issues are. And it's devastating to see how prevalent and rooted these issues have become. Really, most doctors and healthcare professionals will admit that their education on body image is scarce at best, and how it affects our child's mental health and overall view of themselves is not something they feel really comfortable discussing or educating parents on. And what they know about eating disorders is somewhat limited as well. There are just a lot of stories that I can share with you about professionals who might misdiagnose or overlook a child's battle with an eating disorder because they're just not sick enough yet. So we have to be so vigilant ourselves as parents. So what about the statistics of our community, the Jewish Orthodox community? What are some very specific statistics to us? Due to the insular nature of our community, of course, we don't like to have a lot of studies done on us, but there are some studies that have been done that have found that Jewish females may be twice as likely to develop an eating disorder. So just to put that into context, we just said a moment ago that between 9 and 12% of people will develop an eating disorder. So that means for us, it's between 18 and 24% of us that could be diagnosed with an eating disorder at some point in our lifetime. And these studies that have been conducted are from before the pandemic, so we don't really have a great amount of study in our community since then to know if that number has increased. But I can tell you, as somebody who works in the community, that I get calls almost daily about girls in our schools struggling, in some places truly of epidemic proportions. And there is that contagion factor to eating disorders as well. And even though we work to be as insulated, like we said, and isolated as possible, nevertheless, Western culture really has had a measurable impact on our communities. I do think there have been huge improvements in the acceptance of mental health treatment overall in our community. However, it still is stigmatized to some degree, and this can be an impediment to early detection of and really successful treatment for all types of mental health illnesses. For whatever reason, in the Frum community, we're finding that eating disorders are a greater source of stigma. So while someone who, might lose weight or restrict their food might be looked at as something more positive if the outcome means that that person might be thin or look more socially acceptable, but when it crosses over to a clinically diagnosable disorder, the stigma is even greater. In fact, very recently, a therapist shared with me that she knows of a husband whose wife is struggling with an eating disorder. And the husband tells people that the reason they're having trouble having children is because his wife has cancer. So the shame is really too great even for him to admit that his wife has this struggle. And sometimes people have this fear that mental health treatment might undermine a patient's faith or observance if they seek help. So this can be an issue, of course, for mental health issues as well as physical ones as well. 60% of Orthodox Jewish mental health professionals believe our community is underserved regarding mental health treatment. 85% of them believe it's due to the stigma surrounding mental health. So I think we've established, right, that body image struggles, eating disorders, they're real issues in our community as well, and that they can be very dangerous and stigmatized issues and start at very young and impressionable ages. So let's dive into, before we talk about what we can do to help, let's have a better understanding about what body image is and how it is created. And the fact of the matter is that women and girls who possess a positive or neutral body image are more likely to have good physical and mental health overall, whereas girls and women with more negative thoughts and feelings about their bodies are more likely to develop certain mental health conditions. The studies show they're more likely to, of course, have eating disorders, but also anxiety, depression, low self-esteem, and even psychological distress. So what is body image? Body image is not necessarily how your body looks, but how you think your body looks. So it's basically about how you feel about your body and in your body. any feelings, emotions, beliefs, or perceptions that you have about your appearance. It is completely subjective because it's about how you feel, and it isn't necessarily realistic or true. It's just something that goes on inside your own mind about your own body. And you can't see my body image when you look at me, and I can't see yours. So when we have a negative body image, we become hyper focused on what we look like. We tend to really compare ourselves to other people. We might hold ourselves to more unrealistic or unhealthy ideals. But if we're able to really create a more positive body image, which might not be positive all the time, but even a more neutral body image, then we realize that our bodies and our appearance are really only one part of who we are, and they're not the only determinants of our self-worth. So when we cultivate this more positive body image, the studies show that it leads to better self-esteem. It leads to more self-acceptance, more self-compassion, and really a lot less impact from the unrealistic images that we see in the media, that we might hear from our loved ones, and even our societal pressures to look a certain way. Body image issues are one of the strongest risk factors for the development of eating disorders, but they're not only a problem for eating disorder risk, they're also a risk for unhealthy lifestyle behaviors and unhealthy weight control measures, things such as the use of laxatives, diet pills, excessive exercise, fasting, maybe self-induced vomiting. Sometimes people use enemas, or they cut out entire food groups, or they skip meals. These are all unhealthy weight control measures. And sometimes when our body image is negative, we do, resort to those. So there are a lot of parts to how our body image is created, and I wanted to high level go through them with you. And a lot of what we're doing today is going to be high level, and we can always, of course, go more deep into it. And if you guys want to do another one down the road with some specific questions, we definitely can do that as well. So the first part that comprises our body image is something called the appearance ideal, which is really what society tells us is the ideal way to look at a certain point in time. And the problem with an ideal is, if there's an ideal or a perfect body or appearance that's being promoted, we try to work to achieve it in some way. And when we work to adhere to this ideal, then sometimes we're compelled to resort to those extreme measures that we talked about in order to help you achieve this ideal. So sometimes this appearance ideal encourages girls and women, we also have our own issues with it, to desire this thinness or this appearance that is neither realistic, healthy, or in their best interest. So it's really important that we realize that the appearance ideal has nothing to do with a health ideal. When you talk about a health ideal, you're talking about nourishing your body, caring for your body, treating your body with respect. It's about overall wellness, physical health and mental health, not just one or the other. So, and the truth of the matter is that the appearance ideal changes over time. It's really a completely arbitrary measure made up by influential people. And there's no benefit to anybody to adhere this appearance ideal. And as you can see, it changes over time in different historical time periods, but it also changes over different cultures. Even cultures that we have today have different definitions of what is beautiful and what an appearance ideal is. So our inner beauty, of course, has to do with how we feel and see ourselves. And no one can take that from you if you don't let them. So the takeaway is that there's nothing objective or inherently beautiful in society's beauty standards. It's simply whatever the cultural and societal trends of the time are, and absolutely nothing else. So the second part of our body image is something called diet culture. And diet culture doesn't just mean being on a diet, because you don't actually have to follow any sort of official diet to be caught up in the culture of dieting. But rather, when I refer to diet culture, I'm talking about this pervasive belief that your appearance and your body shape and your weight are more important than your physical, psychological, and general well-being. And it's really hard to spot, I'll be honest with you, because we all grew up, we're kind of living, I call it almost like a goldfish bowl. We're all swimming in the same water. We've heard the same messages over and over. And sometimes it's really hard for us to step back and recognize that we're hearing these messages that might not be true. And we have a lot of, I would say, learned beliefs and values that we've gotten from this, but we have to kind of step back sometimes and question them. And it can be uncomfortable to do. The idea of diet culture, honestly, could be a presentation in and of itself, but I want to give you some examples of what we're talking about when we say diet culture. Just that overall belief that your appearance and body shape are the most important things that you should work to achieve, that thinness and being attractive is more important than your actual physical and mental health, and that you should subscribe to a very rigid and specific set of expectations for your body to become that certain way. Just the idea that controlling your body specifically and particularly through your diet is praiseworthy, normal, and expected. Okay, so the next part of our body image is made up by something we call weight stigma. Weight stigma is any discriminatory act or belief that's targeted towards someone because of their size or shape or weight. And there are many, many, many studies about the long-lasting negative outcomes that are associated with weight stigma. There are really very significant associations with some serious long-term emotional and physical consequences for children and teens who experience weight stigma. I have some of them up there, as you can see. It can also not only lead to emotional distress, but depressive symptoms, anxiety, low self-esteem, even suicidal thoughts. But really, it's been shown to also lead to long-term weight gain. So there are a lot of negative outcomes to weight stigma. And sadly, we find weight stigma everywhere. As you can see, we find it in, employment and in media, in our own families, in our relationships, even in healthcare. What the studies show is that when we experience weight stigma, this can lead to bullying, which could be physical bullying or could be emotional bullying. There's often a lot of teasing associated with it. And also people tend to get blamed for any illness or weight problem that they're struggling with, which might not be due to what they're eating. It could be due to genetic dysfunction or disorders or stresses or medical conditions or life stages. There are a lot of factors in why our body looks a certain shape and weight. It can also lead to a lot of guilt and shame around food and eating and reluctance to get help when needed. I just like to put this picture up here is from a From magazine, which promotes diet culture. And so there's even a column in the magazine that's called Girl on a Diet. This one was Family on a Diet. And that's really dangerous. We're going to talk a little bit more about it, but putting your child on a calorie restrictive or food group restrictive diet leads to definitely dangerous mental, cognitive issues. It can lead to malnourishment. It can lead to growth issues, bone issues, brain issues. The studies show it leads to increases in cravings and hunger. It really even damages your child's ability to recognize their own hunger and fullness cues. So we're going to talk about this a little more later, but I like to kind of point out just how dangerous it can be. Of course, media and social media are also parts to how we create our body image. And again, sadly, this is not an area that we are immune. While our levels of usage in our community of some of these types of media might be lower, it's still there. And it's still influential in our children's lives. And unfortunately, we're really not going to be completely able to remove this from our kids' lives. So it's almost dangerous for us to believe that we can do that. We know kids are much more savvy than we are when it comes to technology, and they're seeing things. If we pretend it doesn't exist, that doesn't make it so. And if we have no idea about social media, then if our child has a question or encounters an issue or a problem, they're not going to come to us for advice and help. And this is even more dangerous. So social media, we know, and can influence inappropriate dieting, inappropriate food behaviors, social appearance anxiety, that intense fear of gaining weight. And these are all found not just via social media, but also via From magazines, clothing store mannequins, peers, just whatever society dictates as attractive and desirable. So we really have to educate our children. The next factor in the creation of body image is family. And of course, this is a very complicated and influential risk factor category. It refers to anybody in the family unit or dynamic, of course, mothers, fathers, siblings, grandparents, aunts, uncles, cousins. There are a lot of dynamics that go on between mothers and daughters, how a mother models her own food and body image behaviors to her children, how fathers speak to their children about their appearance, how siblings speak to one another. I could tell you many stories of, grandparents who want their grandchildren to lose weight, so they offer them to pay them per pound. They'll pay them money, or they'll take them on a trip, or they'll take them shopping. There are a lot of stories about mothers who might not let their daughters eat what the rest of the family is having because they think they need to be on a calorie or, restrictive diet, or won't buy their kids the same, clothes until they get back to the family size. there's just a lot of places where we reinforce praise for weight loss. So there's a lot of places where things can go awry. And it's specifically influential when up until the child's about 11 years old. The parents are central to the child until that age. But after 11, the child becomes more connected to their peers. So we have to really start these conversations and how we talk about things very early on. There are a lot of studies, and I'm not going to go through them with you, but I really do first like to say that I truly and deeply believe from the bottom of my heart that mothers and parents are never intentionally trying to do or say anything that would harm their daughter in any way. The problem is, like we talked about, we've grown up in that same culture and with the same struggles ourselves. And so this is what we know. And we don't want our daughters or our children to suffer with any stigma or bullying or ridicule over their body or weight, especially if it's something that we struggled with. But what we actually need to understand is this is exactly what we're doing, and it can cause irreparable harm to our child. So we have to be so careful, because mothers are so influential in their daughters' lives. Dr. Leslie Sim, who's the clinical director of the Mayo Clinic, said that moms are probably the most important influence on a daughter's body image. So even if a mother says to a daughter, "You look so beautiful, but I am so fat," this can be detrimental to your daughters. So we have to be so careful how we speak to them. There are also a lot of pressures that our community faces that can be influential in the creation of our body image and risk for eating disorders. And I'm not going to go through them in detail. I just want to kind of give you an idea. I'm sure, academic pressure is very clear, going to the right schools, getting good grades, perfectionistic pressure, just that, need to be perfect, do it all and do it well. We have shidduch pressures. We're all very familiar with this one. We have a lot of thin pressure in our community and something called the superwoman ideal, which, a lot of times girls will talk to me and I'll hear that they see their moms just doing everything, right? They have children, they come home, they're still making the lunches, doing the laundry, keeping the house clean, having their profession, spending time with everybody. And they don't realize the struggle that the mother's going through. And so this can actually put pressure on them to feel like when they need to ask for help or when something goes wrong with them, that they're not perfect. And this is hard for them to internalize. And of course, sometimes we have increased family responsibilities in our families as our family sizes tend to be a little bit larger. So sometimes older siblings do have a lot more responsibility a little earlier on. Food, of course, is a subject that I'm sure you've all been waiting for. It's a very complicated subject. We are a religion surrounded by food and eating, and this is very difficult even for the least body-obsessed individual. But for somebody who's really struggling with their body image, Shabbos, Yom Tov, Simchas, parties in school, these all create a lot of stress, a lot of confusion and risk for them. So we have to be careful about the messages that we give our kids, how we use food in our family. Is it a reward? Is it a punishment? Or is it a tool for our health and growth? And again, when we talk about how we can help our daughters, we're going to talk about this a little bit further. But it is important that you realize that when you take food off the table as a warning to your child to not overeat, or you hide food from your child, this can also give them feelings of guilt when they eat to feel full, and it can result in children being scared to eat food. They might feel guilty that they ate too much or eat more than they're hungry for because they're nervous that the food will be taken away from them. But we're going to talk about this a little bit later on. And then there's the category of mixed message perception. So when I talk about this, I'm really talking about some of the messages that we give to our girls might be intended one way, but they might be perceived another way. So the relevant and significant part, of course, is how they perceive the message, not what we meant to say. When we talk about the concept that our neshamas and our internal connection to Hashem is really what's meant to be primary, but we might unintentionally give them a mixed message when we place a lot of stress on their externals, right? And their physicality, such as looking good, being thin, dressing well, getting into the right schools, marrying well. This can create a mixed message for them. And we tend to make a really big fuss about people who are disciplined enough to lose weight. We have a lot of messages with shidduchim. Perhaps, we say that it's about what's on the inside, but you should still look really good. Even the message of tznius, which again could be a longer conversation, but the idea is that when the girls only internalize the physical message of tznius and not the beautiful hashkafa and philosophy that is primary to it, this can be taken as a mixed message. And also, we have to be so careful about how we talk to our girls about their physical bodies. Sometimes we don't talk enough about how they grow and develop and what is normal and what is expected and what a bracha this is regarding our bodies. So these all can be places where, they could get a mixed message. So the most important thing to keep in mind here is that when we think about our own body image and how we speak to our daughters, we have to remember that our physical appearance is not always in our control and within our ability to regulate, right? There's so much that is genetically predetermined and other things that change with time. We have hormones. They go through puberty. There are stresses that add to it, sleep issues, family habits, the culture that you grow up in, the age that you are, even your socioeconomic status makes a difference, as do medications and medical conditions. It's important that we stress that our bodies are gifts from Hashem and they help carry us through our lives. And they're kind of the vehicle that carries our neshamas through this world. And it's our job to take care of them with great respect and values. So the idea is we have to find that balance, right, between caring about our parents and letting it control or dictate the story of who we are and what we stand for. When we have a very negative body image, this can be a real risk for the development of an eating disorder. And so just before we get into our recommendations, I wanted to give you a better understanding of exactly what I'm referring to when I talk about an eating disorder, because sometimes people think that an eating disorder is an emaciated girl, but that's simply not the case. So eating disorders are actually very severe illnesses and the onset of them is very complicated because it can be different for each person. They are often chronic illnesses that are very debilitating. They're difficult to successfully treat. And the studies show that over 95% of the time, these illnesses come with another mental health issue, either OCD, anxiety, depression, post-traumatic stress disorder, panic disorder, and something else usually goes on with the eating disorder at the same time. I think it's also really important to know that food is not the cause of the eating disorder. It's actually the vehicle that is used to express the eating disorder. It kind of helps the sufferer give voice to any inner emotional turmoil or struggle. So I'm going to just very briefly go over the types of eating disorders that are listed in the standard classification for mental disorders that are used by health professionals. The DSM-5, the first is anorexia nervosa, which I think you're all very familiar with, but the idea of that persistent restriction of food and that intense fear of gaining weight. Most of the time, these individuals do present with a very low body weight, but that's not always the case. And then there's something called bulimia nervosa, where people have these episodes of binge eating. When I talk about a binge, it's an excessively large amount of food, not something that you could normally eat. And during this excessive intake of food, the person feels kind of a lack of sense of control over their eating. And these binges are always followed by some type of compensatory behavior. So that might be self-induced vomiting, extreme exercise, the use of laxative, enemas, like we talked about. Some people use ipecac syrup for that. And then there's one called binge eating disorder, which is just like bulimia, because they have the binges, but there are no inappropriate behaviors to compensate for the binges. So they just are having the binges. And there's one called ARFID, which is avoidant restrictive food intake disorder. Oftentimes we characterize this as just extreme picky eating. It particularly impacts children mostly, but people with ARFID have a genuine lack of interest in eating and food. They get full quickly. They actually fear food. They're afraid that they might choke or become ill. They have issues with the textures and taste and smell of food. So it's a little more involved than some of the other eating disorders. And the last one is called OSFED, other specified feeding or eating disorders. And these people just have very extremely disturbed eating habits, distorted body image, and an intense fear of gaining weight. There are examples of these, but we're not going to go through them today. So it's important to know that adolescence in particular is a time of increased risk, as it is a time of tremendous growth and change. Adolescents are developing their own thought and belief system. They're fostering their own independence. They're really working to create and solidify their own personal relationship with Hashem. So they undergo many physical and emotional changes. Their brains are maturing during this time, and there is an increased need for them to have energy and nutrients. And any period of time during adolescence where they have a reduced intake of nutrients can lead to that mental impairment, like we talked about. They have a hard time reflecting on their emotions and feelings. They're extremely impulsive. They're really prone to kind of quick or knee-jerk decisions to kind of maintain that feeling of being in control. And it is a time of social identity formation. Social identity just means how their sense of how they belong to their community and the members of their community. So prevention really is the key. Clearly, from all we've discussed, prevention is needed to head off these disorders. And the research shows that prevention programs that are focused on the right messages have had measurable success. But we have to make sure that our programs for our community are meaningful, appropriate, and cognizant of our sensitivities and culture. We also have to make sure to implement these programs during adolescence, because that gives them the best chances for long-term success, because health expectations and perceptions during adolescence are still changeable. All right, as parents, we have a big job to do, but the organization that I run, ATSME, does its job to help as well. And our programs have specifically been created to build up our girls' body image while fostering self-compassion, reducing the focus on outward appearance, ultimately, hopefully, helping our girls discover and appreciate their unique selves. So we are finally here. What can you do today to help your daughter create that mindset and have those skills that she might need to have a healthier body image and offset eating disorders? Number one, we must change the conversation, right? We have to stop focusing on externals. What we look like is not as important as who we are or our relationship with Hashem or what we do or how we live our life. And so sometimes we teach our children that it's really what's on the inside that matters most, right? But we might model or reinforce the importance of what we look like on the outside. If you think about what you say to people, most times when you meet them in the street or you talk to them, you compliment them on their clothing, on their hair, on their sheitel, on a weight loss, all external things, especially for little girls. So it doesn't mean that you can never compliment them on a physical thing, but I think, we need to change the focus and try to talk to them about, something about their mitos, their qualities, their talents, their abilities, their accomplishments. Try to change the conversation. And of course, talk about our bodies with our children as the vehicles, like we talked about, that carry our neshamas in this world. Hashem gave them to us, and it is our job to be so careful how we take care of them. And again, our appearance is only one part of who we are. It's not reflective of the inner, most important part of who we are. It's also really important that we change the conversation around food. Food is fuel. It's nourishment. It sustains us. We need food several times a day, every day. I like to give the analogy that you should be conscious that you're growing a flower. And I heard this from a dietitian that I work with as well, Yafi Lavova. She's very good. And the idea is that you are the soil and that you support, nourish, and promote the growth and development of your child. So adequate nutrition is really fundamental to the healthy development of your child and the maximization of their potential. And it's not only about the quality of the food that you give them, but it's also about the quantity of food. We shouldn't become a bully in an effort to help our child. Also, we should never use food as a reward or a punishment. It shouldn't be used, for a reward for in school. It shouldn't be a reward for losing weight. It shouldn't be, a reward for going to camp, not for anything. It should be used as a tool for our health and growth, and that's how it should be recognized. The problem is, when you use food as a reward or a reinforcement of a behavior, you actually undermine your child's healthy eating habits. And this can potentially disrupt their ability to really recognize and respect their hunger and fullness signals. And it can make food about feelings of achievement or an alleviation of a negative emotion, right? If we use food as a short-term incentive, it can actually have long-term effects on the child's relationship with food. They can become reliant on the food to soothe themselves or regulate their emotions. And it's really important that we don't make food about morality. Food isn't good or bad, and neither is the person who chooses to eat the food. Of course, the conversation has to be about moderation and balance. And we know that you don't want your toddler to eat 5 bags of potato chips or a pound of candy. But sometimes you have to explain to them why foods can help. Certain foods might help them grow strong, and other foods might be fun. Sometimes foods that we have when we have celebrations or Yom Tov or something special. Because food, we know, is so much more than the ingredients or the items on your plate, right? It's the heart of so many of our experiences. It's in our moments of celebration. It's in our Yom Tovim, our holidays, our family rituals. And so make the talk more about healthy habits, right? Movement for feeling good, elevating our mood, making food choices that support our growth and health. This one's really important. We have to get help for our own body image and food issues. Kids really respond to modeling and they pick up on cues that are not verbal. So if you're struggling with your own food and body image issues, your daughters and your sons really will pick up on this and be affected by it. You really need to take care of yourself and get the help that you need. And it isn't just for yourself, it's really for your children as well. I love this quote. It's so important for you to create this intentional mindset. Wilma Rudolph was the first American woman to win 3 gold medals. And she said, "My doctor told me I would never walk again. My mother told me that I would. I believed my mother." Really, as a mother, you are the singular most powerful resource your child has in the world, especially your daughter. Your influence is profound. And whether it's done consciously or not, you are impacting your daughter's sense of self, her values, what she chooses to prioritize in her own life each and every day. So your influence really starts before she's born and will be here and go on long after you are no longer in this world. Really, I love this idea that food peace starts with inner peace. We can't make peace with our food until we've made peace with ourselves. And we really have to be so careful not to judge people based on their weight or shape. We talked about weight bias a little bit earlier, and we talked about the harm that it can cause, how it's associated with adolescent depression, substance abuse, disordered eating, suicidality, eating disorders. Even we talked about the fact that there are studies that show that it leads to weight gain in adulthood. And unfortunately, we've all been guilty of this at some point or another, but I think it's really important that we work really hard to stop talking about people's weight and judging them based on that. I think it's important that we speak to our daughters and tell them that our bodies will go through many journeys in life, right? They're going to go through puberty and pregnancy and menopause and aging and physical illnesses possibly, and emotional and social stresses. These take a toll on our body, and we shouldn't be judgmental, not on ourselves or anybody else, for everybody's journey or their body weight or their body shape. And this one's also very important. When you tell a child that they need to change their weight, they think that something is wrong with them. And even when a medical doctor tells your child that, they think something is wrong with them. So you might want to have the conversation with the doctor before you visit, that you don't want them to talk about your child's weight in front of them. It's a conversation you need to have with the doctor, and I'm not telling you not to have it, and it might be a concern, but you might tell them that you'll have that conversation with them because it's too hard for your child. Sometimes we think that the child will take it better from the doctor, but the reality is the studies show that all they hear is that you think I'm fat or I'm obese or I'm unworthy or I'm unlovable. So we need to change the conversation to be more about healthy habits and things that the entire family can be involved in. And make exercise about joyful movement. Exercise is really an important tool in a lot of parts of our life. It shouldn't be about burning calories or weight loss. Studies show that exercise leads to improved mood, reduced stress, better sleep. Children pay more attention in school who move their bodies regularly. They get more help with their emotional regulation. They have better body image. They have stronger immune systems, and their self-esteem is better. So really, moving your body is so important. And I think also it's important to remember that there are certain developments that happen during adolescence that are relied upon for a person's whole life, and they can have long-term implications on their physical and mental health. So for instance, during adolescence, peak bone mass is achieved by late adolescence usually, and they rely on this bone mass. We rely on it for our whole lives. If you don't have good bone mass, you might be more susceptible, of course, to fractures or breaks when you get older. During adolescence, your cognitive or mental skills are being formed and formalized. So your brain needs proper nourishment. And also during adolescence, children gain 50% of their adult body weight. And for the vast majority of children, their height is actually determined by the end of adolescence. So it's 100% normal for them to be growing and developing, and they need the nutrition and nourishment of food in order to do this. We talked about the idea of social comparison, social media and comparison. And it's really important that you sit down together and talk about the dangers of social media. We have to tell them how the images that they're seeing are not realistic or expected. Pictures are doctored, they're altered, they're changed, they're modified before they're posted. The only thing that has value in social media is how things look. It's just all about physicality and physical perfection that matters. It's not about anything internal. And really, only happy and positive things get shared on social media. It doesn't talk about how many pictures that family had to take to get that perfect one that they posted online. Um, and it's important that they know. Studies show that the overuse of social media can lead to anxiety, depression, low self-esteem, even make you feel like you are not as worthy as other people. And again, of course, we have to be so careful how we speak to our daughters, that we're not overly harsh or critical about ourselves or about other people, and help them value themselves based on their unique talents, abilities, and character traits. And we want to help support a healthy identity. So, when our children are going through puberty and adolescence, it's important that they know that emotions and hormonal changes are just normal and expected at this time, and that they can make things difficult. Let them know that you're here to talk to them about those things. It's really helpful sometimes to help our child understand that there are things that are in their control and out of their control. And that kind of helps them with their feelings about things when they know that there are certain things they can't control. Try to create that home environment that is not judgmental, and give your child the ability to make their own choices sometimes. And of course, this has to be done within reasonable limits for their age and maturity level. But when they're able to make their own choices and have control over certain things, then they don't need to take control out in other, maybe unhealthy outlets. And of course, we know that our love is unconditional to our child, but we want them to know that it is. But that doesn't mean that there aren't rules and structure, of course, and discipline, but I do love you, and everything that I do for you. Okay, so the final thing that I really wanted to mention, and again, this could be a whole presentation in and of itself before we get to our questions, is what do I do if my daughter asks me, am I fat? Or if she says, I am fat. So I'm just going to give you a couple thoughts here. And again, if people have an interest in it, we can have more conversations about this down the road. But number one, you have to understand what fat means to them and where this is coming from. Fat, often, when people say I am fat, or a child says I am fat, it's often a word when we use when we're masking other underlying feelings of anxiety, depression, or low self-worth. It doesn't necessarily mean that they feel that their body is fat. It's also really important that you don't say to your daughter, no, you're not fat, because whether she's fat or not, it doesn't matter, because then you're reassuring her that fat is something bad, but she's not that. So if her body changes throughout life, then she's going to think, well, now my mother thinks I am bad because I really am fat. The conversation should be more about all bodies being good bodies, that a child's, weight or size. We have to be so careful. We have to focus more on respect and care for our bodies, and validate that the hurt that they're feeling, but don't reinforce that there might be something wrong with their body. You can say something like, we live in a society where sometimes we feel like we have to look a certain way, but this is simply not true. Hashem created you just as you're supposed to look. Your job is to properly take care of the amazing body that he gave you. Try to empower your child, because just because someone said something to them, it doesn't mean that they have to respond to it or believe it, for that matter. And we know that just because they change themselves, it doesn't necessarily mean that it's going to change how they feel about themselves. So conforming to what other people want us to do doesn't always end up making us happy. So encourage them to dig deeper, make sure that they know that they don't have to change their body, and of course, be consistent with your messages. And don't feel bad if you don't have an immediate answer. You might say, hey, this is a really important question that you're asking me, and I'm going to look into that and get back to you. That's really good. All right. So sometimes the question on everyone's mind is then, is it really possible that I can take back some control around my thoughts and my emotions? And the answer is yes. I mean, you can see through this amazing quote from Rabbi Pliskin that the quality of your life is dependent on the thoughts you choose to focus on. So through the practice of self-compassion and learning how to deal with our emotions, we can change our thoughts and the quality of our lives. But this is another workshop that we give, but this is also really, really helpful. So if you notice any worrisome or concerning behaviors, I highly recommend you be proactive. Early treatment is best. So number one, trust your instincts. You know your daughter best. If a doctor doesn't believe you, but you're still concerned, go to another doctor. And don't blame yourself. That's first and foremost. You can see from this presentation that eating disorders have a very complex onset, as do body image issues that are affected by many things. I don't believe that anything occurs in isolation, and blame really never serves a constructive purpose. Get referrals, right, from your pediatrician's office, from your school social worker. They should have some good referrals for you. And there are organizations also that can kind of help with this. Ayala Hashachar, Relief, Magen Avram. Ask questions. Don't be afraid to ask practitioners and treatment providers any questions that you might have. You're your child's best advocate, so take the time to educate yourself, and of course, seek support for yourself as well. And I love this quote from Rabbi Twersky. This is what I end with, but sometimes we might let what we have done in the past interfere with our ability to move forward and grow. But let's not get stuck in what we've done until now. Rather, let's learn from it and create this positive change that we want to see. Okay, so that is the end of the presentation. I'd love to answer your questions. Rivka Kalani, who is Atzmi's program facilitator, will be joining us now to answer the questions that you have raised. Hi, Rivka.
Hi, Dr. Marcy Forta. That was incredible. Thank you so much for that fantastic presentation.
Thank you, Rivka.
I do think that some of the questions had been answered, but I still want to ask them just in case anything was left out.
Okay.
So here we go. I'm going to start with, how do we teach our daughters not to want the societal ideal?
Okay, so that's a great question. So like we did speak about in the program, we are the primary resource for our daughters and their body image until about age of 11. So they model our behavior toward our own bodies. And there are even some studies that show until about 8 years of age, girls are so connected to their mother's bodies that they can't tell the difference between them. So how a mother feels about her daughter is exactly how a girl responds to her own body. So as long as we are reinforcing these positive messages and speaking to them in the proper ways and contextualizing the messages that they see in social media, I really do think that these are the positive ways to affect change in our children.
Okay, thank you. Okay, here's the next one. How do you deal with situations that involve health-related issues? Both my daughter, age 11, and son, age 14, are not overweight. They're on the thin side. However, they both have high cholesterol, and my daughter also has had a history of prediabetes. As such, I do discuss the importance of eating balanced meals, choosing healthier carbs, and limiting the unhealthier foods. My daughter sometimes gets nervous to eat certain things and gets worried. I really don't want her to develop a negative association with eating. How do you suggest to go about this? Thank you.
That's a great question. And I actually love the issue that's raised there, because sometimes we assume that only people who are on the heavier side are going to be the ones who are going to suffer or struggle with high cholesterol or prediabetes. And it really just shows us that sometimes we have a genetic predisposition to something, and it's out of the realm of what maybe you're eating or doing. So I think it's important that we try not to be very strict and severe in how we present things about food. We give them good suggestions. We serve healthy, balanced meals. We give them the options on occasion to have treats and do things, that are a little bit different. I think we have to be really careful how we present food to them and talk to them about food, because food is a tool for their nourishment. But the more you create stress around their pre-diabetic situation or cholesterol, that also has an influence on the outcome as well. So I think I would say really to talk to like intuitive eating dietitian who can really help you navigate that. That's their specialty and they're really good at it. I can definitely even give recommendations for that if someone wants to reach out to me at some point. That would be really helpful.
Amazing. And I think just in general, when we send the recording afterwards, we can put that in the recording, some resources in case anyone feels uncomfortable to ask.
Sure.
Thank you. Okay. The next question is, when someone says to a young picky eater, "Eat, don't you want to get big and strong?" What would you recommend saying instead of that?
So honestly, the more you force that child to eat, it's really important that children grow to feel their satiety and hunger cues. When a child is an infant, and if you think of it this way, when you feed an infant, right, they might stop eating, and you don't force them to finish nursing or have more from the bottle. If they're done, they're done. Your body has a set point and it kind of knows when you're finished. So unless a child is really not thriving properly and growing and they're falling off their growth curve and there's really like a malnourishment problem that your doctor is concerned about, I would say to try not to force. Forcing the issue will only give them negative connotations with food. And every time they sit down for the food, they're going to be distressed about, did I eat enough? Are they going to force me to eat this? If it's a real problem, it could possibly be like we talked about ARFID, that avoidant restrictive food intake disorder. It's possible that child has issues with textures or tastes or fears around food, and occupational therapists can really help with that as well. So I think you need to find out where that issue is coming from, and then we can figure out how we could help that child.
Okay, that's great. Thank you so much.
Mhm.
The next question is, my daughter is on the heavy side and often voices that she feels fat and uncomfortable in comparison to other girls in her class. Yet she also craves sweets and snacks and is frequently eating, sometimes in a way that feels compulsive when she is at friends' houses or when I'm not around and monitoring. Should I let her take the lead in deciding when she wants to eat more conscientiously and just remind her that she is beautiful and healthy, or is there another approach in this situation?
It's a great question, and it's a hard situation. From the tone of the question, and obviously I don't have all the information, it sounds like there could be, you are monitoring her food intake. So it could be that she's feeling that restriction. You know, the studies, like we talked about, really do show that the more that you kind of restrict or limit or control, and your child feels that, the more they will find a way to eat. So if you don't allow certain foods in your home, they're going to find it at their friends' houses. They're going to use their allowance money to buy it. They're going to find a way to eat it. So the more we can make peace with food, of course, the more they will be able to feel their own hunger and satiety cues. So what we might want to do is allow her to have more choices over what she eats. There will be a transition time for sure where she'll overeat. But then when she realizes that you're not taking these foods away from her and she doesn't have to feel stress about the fact that she won't be able to get it another time, so she has to eat it all now, things will level out. It's also possible, though, and you have to look into this because you said sometimes it seems like it's, I can't remember the exact wording you use, but that, you know, she seems to be a little compulsive, maybe is what you said. So it could be that she's having some emotional issues that are coming out through her relationship with food. So I think that that's something you might want to think about. And if that's the case, I would suggest trying to find somebody that she can speak to about that, because that does happen sometimes as well.
Okay, great. So a few more questions are coming in right now. So I think it relates to what you're talking about. What if they struggle with sugar, they know it's not good for them, and then they regret it after eating a lot of it, knowingly?
And again, we have to sometimes give our children the ability to make those mistakes, right? They might want to eat, they might one time eat too much of something and get a stomach ache and realize, hey, that's not something I want to do down the road. But if we're in their ear saying, sugar's bad for you, sugar's going to give you a stomach ache, you're really not going to feel good if you eat this, they are not hearing their body because they just don't want to listen to what we're saying in the background. So if you give them that ability to a couple times make some uncomfortable choices, in a normal situation where there's not an emotional eating component or something else that's going on, they will balance it out and they'll be able to realize, oh, I don't like doing that because it hurts my stomach, or I feel sick when I'm done. They might do it on an occasion at a special party or something, a bar mitzvah, a celebration or something, but generally they're not going to do it anymore.
Okay. And what if they have gained weight and are voicing concern? Can we discuss healthy eating habits and exercise as options?
What I would say is that, we you the problem with saying something is healthy or unhealthy is, we do moralize food a little bit that way. We can talk about what might be more nourishing for our body, what might make our bodies feel better and give us energy. I would try to take the conversation off of weight if at all possible. I would tell them that, all bodies are shaped differently, and your body is beautiful just the way it is. But if you're not feeling good, you're tired, or you don't have enough energy to get through the day, we can make some changes in some of the foods that you're eating to give you more energy and to feel better. I would also say that exercise or movement we need to do that every day. We need to do that for our health for a variety of reasons. We talked about all those things that movement does for us. I wouldn't focus on it being about changing her body. I would make it more about how we can make her feel better about herself. And weight probably will come off as a result, but that's just a side benefit. We don't want that to be the main focus.
Okay, perfect. And what is the appropriate age to talk to your daughter about her body changing? I don't want to be too early, yet I don't want her to hear the information from someone else.
That is a great question. And, puberty starts at such different ages for different kids. And even if your puberty maybe started later, maybe even 14, your daughter might go into puberty at 8 or 9. There is somebody that I speak to. Her name is Toby Ash. She does a lot of work in talking to the girls about puberty. And one of the things she said is it is really difficult for kids who either are on the very early end or the very late end because they feel different from their peers. So I think having that conversation with your daughter a little earlier at a very high level, maybe not going into so many details, but just some of the concepts, and to come to you with questions, or if she notices, maybe some spotting or she's developing or things are changing, that she should come and talk to you. Just give her some high level thoughts about it at 8 or 9, and then maybe go a little deeper into it at about 10 or 11. If she starts to notice things, then for sure go into it a little earlier. Just keep it age appropriate.
Okay, so I can relate to this next question. Don't we all do emotional eating?
It's a hard question to answer. I think it's a great question. I think like I said, we experience food differently. We use food when we're happy because it's part of how we celebrate simchas. We have cultural foods, we have family foods. Food is love. We feed our family. So I don't know if it's always all emotional. Some of it's just joy. Yes, there are times when we'll have emotional eating. I think we need to try to figure out, where's that coming from? What's really going on that I feel that I want to eat like this now? Talk to ourselves a little bit to try to kind of figure out what's going on with you. I guess I can't really answer that completely because I think eating comes from so many different places. It's not only emotional. We might overeat when we're just in a good mood, or we had a great day, or we were more active that day. I don't know if it's always emotional, but there's definitely emotional eating for sure.
Okay, and in the same line as that, does it exist to actually have non-emotional eating when consuming sugary foods?
Yes, if you truly work on that intuitive eating, which again could be another whole presentation, but if you're in tune with your body and right now you feel like I'm really in the mood for a scoop of ice cream, or I'm really in the mood, for this chocolate bar or whatever it is, and you just eat it and then you're done and you've satisfied your sweet tooth and you're finished. There are two parts to our hunger. There's the physical hunger that we feel, and there's the appetite. Sometimes that's why we can always eat dessert, right? We have a physical hunger that gets full usually from the food that we eat, but we still have that appetite for something sweet maybe after we're done eating. So if you don't really feed both your hunger and your appetite, you never really feel full or sated. So I think, I don't know that it's a bad thing necessarily. I just think that we have to kind of be in tune with ourselves and not use it as a tool for emotional outlets for things. It's just like, I'm in the mood and I want one right now, and I'm going to have it, and then I'm not going to feel guilty for it, and I'm done. I don't need another one.
Thank you. Okay, so this is just a little bit more about you, this question. How did you get involved in ATSME, and do you feel comfortable to share just a little bit about your journey?
Oh, wow. Okay. So at the beginning, I talked about the fact that I owned a women and girls clothing store. It was about 15 years that I ran that store. And, it really bothered me how much stress there were for people coming in and getting dressed and buying clothes and feeling comfortable in their bodies. It resonated with me, like I said, because of the fact that I did struggle with an eating disorder as a teen, and for several years. And I was very fortunate that I was able to get the treatment that I needed and get over it. But not everyone is as fortunate. What I realized when I sold the store was that really everyone is going through this struggle. And because eating disorders are so deadly and difficult, I really wanted to step in and help before it became an eating disorder. Prevention is really the best way to deal with eating disorders. So I kind of went at it from a different direction. And that's when I went back to school and did my doctorate on risk factors in the Jewish Orthodox adolescent female community to better understand what it is that might make us more like I said, we have that propensity that's up to 2 times higher than other people, which could be genetic. There are a lot of genetic predispositions in eating disorders. But so ATSME was created to help us offset some of those eating disorder risk factors. But because eating disorders don't occur in a vacuum, and because there are always emotional and other components that go along with it, I wanted to support our girls in finding and appreciating their unique self as Hashem has blessed them. I want them to feel like they're special just the way they are. And so yeah, I created ATSME really with that in mind. And I feel like parents and teachers who are primary in our daughters' lives also need to learn about this a little bit in order to help our daughters. So I guess that was kind of the journey. So this is the first year that we've offered our curriculum, and Baruch Hashem, it's been really well received. We're in over 15 schools, and we have a lot more signed up for next year. So, Baruch Hashem, it's been quite a journey.
So along those lines, we're so excited that you have this curriculum in the schools, and so many of our daughters are going to benefit from it. If someone wants to bring this program to their school, what is the best way for them to go about doing that?
Definitely have their principal or social worker or anybody from the school or themselves feel free to reach out to me via atsme.org. You can fill out the form there, or my own website, which is marcyforta.com. If you fill out that form there, it goes straight to me, and we can set up a time to speak with them and show them the curriculum. I show every school the full curriculum beforehand. They're privy to all the tools. Our curriculum is actually subsidized. It only costs $10 per child. I don't charge for anything else, just for the cost of the journal. Everything else is subsidized through generous donations, which we can always use, but this has been very helpful. So every school should be able to have access to it because of the fact that it really isn't costly. And the parent programs and the teacher programs are also provided at no cost. The age groups, I'm just seeing a question coming up. We have 4 sessions in the 8th grade, 4 sessions in the 10th grade, and 4 sessions in the 12th grade. That is what we do for the kids.
Okay, amazing. Okay, let me just see here. My daughter is in shidduchim, and the pressure makes me feel like she has to always be so put together, always dressed so nicely and makeup put on, always watching what she eats. How can we change that narrative? I'm nervous if she's overweight, no one will want to go out with her.
Yeah, this is a great, hard question for certain. I think we have to kind of look at it in terms of small changes, right? We're not going to change the system overnight. We're all going to work together to figure out what's the best way to kind of make these small changes. But if we as mothers are nervous and uptight and stressed, our daughters will definitely feel our energy and how we're feeling about things. Maybe it's very hard, but sometimes you have to kind of step back. Hashem has that plan. And as long as your daughter's really taking care of herself, meaning she is eating nourishing foods and she is moving her body and her blood levels and other things are looking good and healthy and normal, I would say step back from the weight issue unless it's a medical issue. Try not to stress about it. She might decide on her own that she wants to make a change, but the more you stress it, generally that tends to have the opposite effect. So you're right, it's an issue within our community, and I think that it's changing slowly, but there's not much we can do to change the system. So we have to change our attitude and our beliefs and our thoughts, and this will eventually spill over, everywhere else.
That's the truth. Okay, so here's another scenario question.
Okay.
I would like to know how, in a world that so focuses on body shape, be it in regard to shopping or while constantly making sure our appearance is to our liking before venturing out of our homes, we can expect our children not to internalize that body shape and size matters. As an adult who has been dieting, sometimes extremely, since a very young age, Food is an ever-present factor in my life, both consciously and subconsciously. Yes, I do think about it excessively, whether about eating or about not eating. How do I break this cycle if I am not willing to let myself go? I have no thyroid, and I've seen from experience that without this dieting, I can unwittingly put on 20 pounds in under a month, negatively affecting my health. And my weight is very important to me, if only because I feel more awake and able to more easily accomplish my daily activities when I am lighter. In such a situation, how can I raise children without this focus on food and weight?
There's a lot of parts to that question. It is also a great question. Um, I think the first thing that I kind of gravitated towards was the fact that she said that her weight is very important to her. Um, we talked a lot about us getting our own help with our body image. Yes, society, social media, we talked about the fact that it has a definite impact. But you being so concerned about your own weight and worried about your weight gain and things like that are definitely going to have an impact on your child, right? And it's just going to add to the messages that they're hearing from society. If we are able to kind of strengthen them from within our home and talk to them about those things and show them that that's not the primary way we talk to ourselves or think about ourselves or treat ourselves, that we treat ourselves carefully, properly and with respect, then our children will actually pick up something different. I think it's not only social media. I think most of it from the studies and from what I've read and what I've seen really comes from within the home. So this might be a case where the mom might want to get a little bit of help with her own body image. And I think that that will actually make a huge change for her children as well.
I agree with that. And that is a struggle, and we do it every day. The next question is, how do we know when normal concern of looks become a need for intervention?
That's a great question. So I think it's quality of life, how it's impacting the child or the person. Is this something they're thinking about all the time? Is this all they're talking about? Are they always looking in a mirror when they walk by it? Are they always judging other people about their appearance? Are they always talking about their bodies or weight? Are they, doing things out of the ordinary? Are you noticing changes to their personality or how they're doing in school? Generally, you're going to notice some changes, or it becomes an obsession. It kind of goes from just being kind of something that they're looking to do to there's a real clear obsession with it. You just have to kind of keep an eye out for changes in their behaviors and stuff like that.
Okay, so there's just a few more questions. So we might be wrapping up in the next few minutes, but if anyone has any other questions, you can feel free to drop it in the chat or email programs@otsme.org, and we will do our best to get back to you if we don't get through to all the questions in this call. So the next question is, what can I do when other people give my kids unhealthy snacks as rewards?
This is a hard one. This was one that I struggled with my own children. I had a fifth grader who, when he won the spelling bee, his teacher gave him a 2-liter bottle of Mountain Dew. And, I had to have a conversation with the school. It's a really hard one. We can't always control what food our children have outside the home. And we have to know that going in, that they're going to go to their friends' houses on Shabbos. They're going to have treats in school. You definitely have to talk to the school and have that conversation with them. But you also have to realize that you're giving them the foundation at home to recognize those hunger and satiety cues and to watch what's going on with their bodies. Give them those great tools, to start out with, and hopefully it'll have less of an effect. That's something that's out of our control. We talked about what's in our control and out of our control. That's not something that's always in our control. So we just do the best that we can. I would definitely talk to your kid's school if that's an issue that's going on there. But we won't always, unfortunately, be able to control that situation. We'll have to kind of leave it up to the kid who has, that good balance.
This next question is, what about PANDAS? PANDAS?
Pandas, yeah.
Pandas?
Yeah. Mm-hmm. Oh, what about pandas?
Yeah. What about pandas?
I'm not sure what the question is. I know what pandas is. You're saying, what about pandas and and food and sugar. I mean, PANDAS is an illness that requires treatment. There may be some special dietary restrictions that people try to work on with the child to see if that helps with their illness. Of course, if a child has celiac disease or a diabetes or an illness where they have to be on a special diet, they have to be on that diet. There's really not much that you can do about that. You're going to have to, talk them through that. That might be a challenge for them, but there's nothing that we can do. I'm talking barring any other major health issue. This is probably, the better way to try to approach food. Yeah.
Okay. This next question is, what does your program teach? Is it nutrition, balance? What will the kids be learning?
Okay, so each grade is a little bit different, but we talk a lot about self-compassion, the tenets of self-compassion, how we incorporate that in our lives. There are 3 tenets of self-compassion and how we use those. We talk about appearance, ideal, and body image. The idea in empirical study for eating disorder prevention is creating a situation where the kids start to wonder if those ideals still serve them and if they can question them. So we start to have conversations with them about the appearance ideal, about body image. We talk about emotion regulation, about boundaries, how to set priorities, how to have healthy relationships. We talk about the value of our physical bodies according to the Torah. We just kind of do different things in different grades, but there's nothing about nutrition. And there is a lot about balance, though. Balance is a key. Here we talk about the concept of beauty in the Torah and where that comes from, and where it has appropriate uses. So but not nutrition specifically, and never eating disorders specifically.
Okay.
I hope that answers it.
Yeah, I hope so too. And if not, whoever asked that question, please feel free to email us. And if we didn't answer it properly, let us know and we can further answer that.
Absolutely. Absolutely.
Okay. What should I say to my family members who make food and body comments to my kids? I can relate to this one very much.
Wow. We have gotten some really, really great questions. So again, this is a really hard one. If you have a good relationship with the family member that's making those comments, you might want to take them aside and explain to them why you're making changes with your child about how you talk about food and their bodies, and that we're not making comments about their bodies and what they eat, and explain to them why you're doing it for your child's benefit. If you don't have that type of relationship with the person, sometimes people will say they'll say something like, we're not, in our family, we're not making comments about food or about our children's bodies. And if they really still can't stop doing that, you have 2 choices. You can either visit less often, which some people do, or you can make a comment when they make a comment in front of your child so that they know that you disagree with this person, and your child sees that you're sticking up for them. So really, those are kind of the only ways that we can work through this, is to have that conversation with them or try to offset it by just saying, please don't do that.
Thank you.
Mm-hmm.
Okay. This next question says, I wasn't able to join before, so apologies if this was covered already. I would love to teach this in schools. Is this usually taught by a health teacher? Who actually is the one teaching this in the school?
Oh, that's a great question. So we actually train somebody in the schools because of the fact that we give it in 8th, 10th, and 12th, and they're 4 sessions in a row. Most of the time, we either have someone trained in it, or we teach the social worker or some teacher in the school that has a different type of relationship and rapport with the girls to come in, because it's not like a class, it's more like a workshop and a conversation. So we have training videos that fully teach the person who is going to be teaching the workshop. They train in it, and I work with them one-on-one till they feel comfortable. And yeah, that is how we implement it in the schools.
Okay, great. This next question is, my daughter is 9 years old and most of the clothing in kids stores don't fit her. She is also tall. How can I go shopping with her and make sure she doesn't feel bad that nothing will fit?
And that is really hard. And that's a lot of what I saw. So I would say sometimes even if it's a very bad situation, that you would go to the store ahead of time and speak with the owner and ask them to have some specific things that they recommend right from the time she walks in that were going to be more appropriate to her size and her height. Make sure you don't take her to stores where they're not going to have her size. They're not going to have anything in her size, so that she doesn't try on a bunch of things and she doesn't come out with one thing. It just might mean that you have to do a little more legwork in that and go ahead. Make sure you go to stores. Unfortunately, I've heard really a lot of stories of store owners who kind of shame people when they come in. We don't have your size. Nothing here is going to fit you. Don't try that on. You're going to ruin the clothes. Make sure you're not going to a store like that where they are really trying to help you, and you feel comfortable taking your daughter there, because you want to make it as positive of an experience as possible. So just make sure it's a place where she can absolutely, even if she doesn't like it, she can actually find a couple things that are going to fit her.
I really like those recommendations.
Yeah.
Okay, so I think that we've gone through all the questions. If there's any last minute question, we can try to answer that right now. But otherwise, we want to thank you, Dr. Marcy Forta and Atsmi. This presentation is phenomenal. The work you are doing is so important, and we are all just so grateful to have someone who has gone through what you've gone through in order to teach us and our children. Thank you so much.
I really appreciate that. Thank you. And if there are ever any other programs that people would like to hear about or learn more about from within this program, like, feel free to reach out. I'm always happy to do that at any time. All right. Thank you.
Okay, thank you so much for coming, and have a good evening.
You too.